We can now repair microscopic heart valves, sequence a human genome in hours, and detect disease before symptoms even appear. But these technical milestones exist alongside a surprisingly simple structural flaw. Patients continue to fall through the cracks of the system. Scientific precision in the lab does not automatically translate to a smooth journey through the clinic. Healthcare operates on an episodic timeline, built around isolated 15-minute appointments, but your actual health never pauses outside clinic doors. It is a continuous, fluctuating experience. The clinic captures disconnected fractions of time, leaving your life in a massive, undocumented vacuum. A perfectly kept medical chart rarely reflects your lived reality because it completely ignores what happens in the space between those appointments. Imagine a patient visits their primary care doctor with a concerning symptom. The doctor orders a test and writes a referral to a specialist. The referring clinician assumes the specialist's office will contact the patient to set things up. The patient goes home, assuming the healthcare system is coordinating behind the scenes, and patiently waits for the phone to ring. Meanwhile, the specialist receives the order and expects the patient to proactively call them to book a time. Everyone is acting reasonably, yet weeks pass. Communication stalls, the test is never done, and the follow-up is missed entirely. No single person failed or intended harm. The fragmented process itself created a blind spot. This systemic void extends far beyond referrals. Consider a patient who takes a newly prescribed medication home. A few weeks later, far removed from the doctor's supervision, they begin to experience waves of dizziness and fatigue. They make a logical assumption that this is a normal side effect and quietly stop taking the medication without telling anyone. The same breakdown happens with mental health. A person struggling emotionally might be handed a referral number, but they immediately run into unseen obstacles. They spend weeks trying to navigate long waiting lists, arranging transportation, or simply fighting the emotional burden of reaching out for help. The care never arrives. Often, the only people actually observing these patterns are family members and caregivers, watching symptoms evolve day by day. The most critical chapters of a patient's medical story are written in the quiet isolation of their own home, unknown to the professionals treating them. Today, a single life journey spans dozens of different providers, specialties, and services over many years. Look at this diagram showing a sprawling web of disconnected dots. Each dot represents an isolated clinic or doctor. What would happen if the healthcare system paid as much attention to the gaps in time between these dots as it does to the encounters themselves? Continuity of care must be treated as a priority, equal in weight to the documentation of a single visit. Our health happens continuously, through every hour of every day, whether we are in a doctor's office or at home. The core challenge for modern healthcare lies in the weeks and months that separate one appointment from the next.